Good morning, everyone. Thank you so much for joining us this Thursday morning at 7:30. My name is Becky McGregor, and I am your Employee Wellness Coordinator. And joining us today from ASI Flex is Andy Megling, and she is going to be presenting today on your flexible spending account options. We are so excited to bring this to you because it's such a wonderful program. We really want employees to know about it and be able to access it and use it. So I appreciate you joining us this early morning. If you've got some coffee, pull on up, and I'm going to just move right ahead with just a couple of house cleaning items for us. We ask that you please mute your computer or phone microphone. It limits distractions for everyone, including our presenter. And we also ask you turn off your cameras. And when we get to the question Q&A section, there might be times when we just ask you to unmute just because it's easier sometimes to ask those questions or to clarify your question or get more expanded input. We do ask you put your questions in the chat box section. We will note them, and we're going to address all the questions in the Q&A part of the presentation. We do have Ann Johnson in the chat box, our senior benefit analyst, to help with some of those questions too, or just some of the inquiries as they come through. And we have Sheila Jaramillo and Andrea Biggs. Sheila Jaramillo is our supervisor over benefit and leaves, and Andrea Biggs, one of our wonderful benefit specialists. So we thank them for being on and in the chat box, able to assist you. All right, so I want to just move on forward. And I'm going to hand it over to Andy. I'm going to stop presenting so she can take on the screen. Andy, there you go.
Okay. Great. Are you able to see my screen?
I cannot.
No.
Can you all see her? Andy, let's see if anybody can. No?
No.
Okay, we can't see it, Andy. On that Present Now button, you just need to hit the tab. If you see the tab. There we go.
How about now?
Now we can see it.
Okay.
Great, thank you.
Great. Yes, thank you. It is a pleasure to talk to you today. Good morning. I'm going to talk to you first of all about what FSAs are. You might have heard of them before, flexible spending accounts. They're an account that you elect each year to set aside pre-tax money. And there are two different types of accounts. There's the healthcare FSA. This is where you would pay for your out-of-pocket healthcare costs or your dependents' out-of-pocket healthcare costs. And then the dependent care FSA, not to be confused with any medical care, that is for daycare costs or before and after school care. It can also be for adult daycare if you have adult parents or someone who needs care during the day. And the way that these types of plans works is first you estimate your expenses, how much you think you're going to spend during the year. You always want to be conservative. We'll talk a little bit more about how to do that. Then you elect your contribution. That's what you'll do during your open enrollment time. Then during the year, you incur your eligible expenses and you submit a claim for those expenses, and then you get reimbursed. And it's usually very quick. Our reimbursement time from the time we receive your claim is just 1 to 2 business days. And with direct deposit available, that money could be yours directly into your account really quickly. The IRS does govern these types of plans, and they state that you must enroll every year with a new election because your expenses won't always be the same. So even if you've been enrolled before, you will need to re-enroll for the new year. You will need to spend all your funds during the year and incur those expenses during the period that you're covered. A period of coverage is going to be for the whole year unless you would leave employment or something like that. You do not have to be covered under your employer's health insurance or under any health insurance at all. And you can use this plan, the medical FSA, to pay for your spouse and dependent children's out-of-pocket costs too. No changes can be made to your election amount during the year, only during open enrollment, except with certain qualifying status change events such as birth and marriage and those types of things that would allow you to change your health insurance. You can access all of your healthcare funds at any time. So even on January 1st, you should have full availability of your entire annual election. If you elect the full amount of $2,750, then you could claim that full amount January 1st and be reimbursed that full amount. Funds remaining at the end of the year are forfeited, except that Albuquerque Public Schools does allow a grace period through March 15th of the following year. So you would have an additional 2.5 months to incur expenses. It is easy to avoid forfeitures if you plan for predictable and recurring expenses, and only the expenses that you know you'll have during the year. You will probably want to review this year, or maybe this year hasn't been normal for a lot of us, but a prior year as a guide to the expenses that you will have, and be conservative with that estimate. If you're not certain that an expense will come up, you might not want to include it. We have many tools available on our website, such as an expense estimator, an eligible expense listing, and the FSA store has resources to indicate over-the-counter products such as sunscreen, sunblock, asthma, allergy, pain reliever, all kinds of over-the-counter supplies and medications that are now eligible without a prescription, and you can just purchase directly through the FSA store. Here are some of the eligible expenses represented. As mentioned, the maximum that you can contribute for the year is $2,750, and this can be for prescriptions, office visits, co-pays, deductibles, x-rays, lab work, hospitals, even mileage to and from your healthcare providers and pharmacy. Over-the-counter items like Band-Aids, blood pressure monitors, supplies, drugs and medicines, vision expenses for prescription eyeglasses and sunglasses, contact lenses and solutions, and anything to maintain your glasses, such as lens wipes, even LASIK eye surgery is covered. Dental work, x-rays, orthodontics is covered, crowns, bridges, dentures, all of those things for your teeth, except for the regular maintenance, such as a toothbrush or toothpaste. Hearing exams and hearing aids and batteries are also covered. Here's a list that you'll find on our website if you want to look at it more in depth of over-the-counter products and medicines that are eligible. New this year, but a permanent change is that menstrual care products are now eligible. So you ladies or gentlemen with daughters also can claim any of those expenses. And moving on to the second category of flexible spending account, we have dependent care expenses. As mentioned, this is for childcare, and there's a maximum of $5,000 stipulated by the IRS. It's for any number of children per year, and this category can include any type of babysitting that you need while you're at work, preschool or nursery school, before and after school care, day camps during the summer, but not overnight camps, and adult care for anyone over the age of 13 who is incapable of self-care. Note the asterisk, if you are married filing a separate income tax return, then the maximum is $2,500. Claim filing options are many. We have a mobile app, which is my favorite way to file claims. It's so simple. You can do it from anywhere when you have your phone with you, and you just need to take a picture of your documentation, say the pharmacy receipt that you got when you picked up your prescription. You just take a picture, upload it through the mobile app, and then your claim is done. You also have the option through Albuquerque Public Schools to use the debit card. You can sign up for you'll be given a card, and you can use the card to pay for expenses that's loaded with your full annual election at the beginning of the year. It isn't always paperless, so we'll talk about sometimes the need to send in supporting documentation to go with the use of the card. You can also send your claims through fax or mail, and online through your account detail, you can submit claims. You will just need to either scan or take a picture of your documentation, upload it with your claim. Again, the mobile app is a free app. It's ASI Flex Self-Serve. You can just take a picture and send it from anywhere. And through your phone, you can also check your available balance 24/7. The account detail you can get to through our website. You'll just need to create, if you haven't already, and you enroll, you'll need to create your username and password. Then you'll be able to log in and check your account detail and submit claims directly through your computer. And use of the card. It's easy. You swipe your card when payment is required. Ask for an itemized statement of the service or supply provided to you. If you weren't given one, you want to be sure that you have that in case it's needed, and then go. If you save that statement or itemized receipt and it's asked for by ASI Flex, then you would just need to upload that through the mobile app or through your online account detail. As mentioned, use of the card is not paperless. There are certain times when it will be paperless. If you purchase items from a merchant who has an inventory control system in place, such as Walmart, they will denote which items are eligible on your receipt, and your card will work for those items. And so we won't need any follow-up documentation. However, if you go to your dentist and you pay for services at your dentist, it won't always be known what you were buying, because all we receive from the dentist is just a total amount that you swiped your card for. So we will probably follow up by asking you for documentation just to let us verify that those services were eligible expenses. So card documentation, here's a little table showing when documentation might be required and when it won't be. If you have a prescription or an office visit copay that matches the employer plan you're enrolled in, we'll get that information from your human resource office, then documentation won't be required if it's a matching known copay amount. Over-the-counter healthcare products, as mentioned, at retailers that keep an inventory, documentation won't be required. A recurring expense at the same provider for the exact same dollar amount, say your orthodontic contract is a regular recurring monthly payment. Yes, you would provide documentation, but only once would be needed for a recurring. Medical care, yes, except for copays, if that copay matches one of your known copays. Vision care, same. Yes, it would be needed except for copays. Dental care, yes, almost always with dental. Hearing care, and again, yes, except for when the copay is a known copay amount. It will automatically adjudicate that card transaction for us. Types of documentation that are required. There is explanation of benefits as perfect documentation that you get from your insurance company, so we can see what part insurance paid and what part they didn't. If it's not covered by insurance, any itemized statement from the provider will work. For the prescriptions, a pharmacy receipt or printout. For over-the-counter healthcare supplies and drugs and medicines, the itemized merchant receipt works just fine. You don't want to send in, though, just a credit card receipt, since that only shows an amount was paid on a certain day. It won't indicate anything about when the service was provided or what the service was. This is a sample explanation of benefits. Yours may not look exactly the same, but this is great documentation for us, and you can usually get these directly from your insurance provider's website. This is a sample itemized statement, and we're looking for the provider's name. We're looking for the patient's name, if that was included, maybe on a Walmart receipt or something like that, it wouldn't be included, but the date of service, an itemized description of the services, and the amount that you were charged. This is a screenshot of the account detail that you will be looking at if you log into your account through our website. You'll be able to see your claims that have been processed, your contributions that have been posted, your card transactions, and if they are needing documentation. So this column that says follow-up documentation required will let you know if you need to submit documentation. And this is available on our website under asiflex.com/debit cards. You'll be able to print out a wallet card if you want to. This is something that you can carry with you, just so you always remember to get from your provider the important information: the provider name, patient name, date of service, description of the service, and dollar amount that you owe. We encourage all of our employers and employees to go green, to sign up for email or text alerts so that you don't have to wait on paper notices. There's a lot of mail being delayed right now, especially, so you don't want to have to wait on a check for reimbursement. So sign up for direct deposit to get reimbursement sent directly into your bank account. You can file claims with the mobile app and avoid paper. You can also have your dependent care provider sign the claim form that we do provide, and then they don't have to provide any additional receipt or documentation, and some don't provide a receipt, so that is one way that they can verify the expense for you. Okay. And that is all I have today. If you have any questions, oh, looks like we do have some questions popping up. Let me take a look at our chat here.
Yeah.
Okay.
And so
Yes.
go ahead, Andy, and you can answer that question if you see it.
Okay, I do. So this question was, if an employee is eligible for the Albuquerque Public Schools Healthcare FSA and their spouse is also eligible for their employer's healthcare FSA, can they both contribute? And for the medical, for the healthcare FSA, yes, they can both do the maximum through their respective employers. For the dependent care FSA, the family maximum is $5,000. So they can't combine for more than $5,000 on dependent care. But you could for the healthcare. You can both do the maximum your employer allows. You just want to make sure you're not claiming the same expenses under both accounts. But if you have that much in expenses, then you could certainly both sign up.
Great. And then I love this question because it's one of my harping points on this is Kristen asks, money is pre-tax and thus reduces your taxable income, correct?
That is correct. Your taxable income is reduced first before your taxes are even figured. So the deduction, the more that you deduct for the healthcare FSA and the dependent care FSA, the less you will pay in taxes.
Right. I just feel like it makes your money go further. For sure. Okay.
It does, right. You pay less in taxes, and that's always a good thing.
Yeah, absolutely. And so let's see, on the DCFSA, what other qualifying events that would allow an employee to make a mid-year change?
Oh, that's a good question, especially this year. There have been so many unknowns with dependent care, and any type of dependent care provider change that changes your cost of care. So this year there were a lot of people who signed up for dependent care and that the daycare's closed. That is considered an eligible event because it's a change in your cost of daycare. Now the same rule doesn't apply for healthcare. You might have a change in your cost for healthcare, but that's not going to allow you to make a change mid-year. But with dependent care, it does. If you have a change in provider, if you have a change in your employment or your spouse's employment, all of those events would allow you to make a change to your dependent care election mid-year. It's a lot more flexible to change than the healthcare FSA mid-year.
Thank you. Miriam has a question about where do we re-enroll. And Miriam, during open enrollment, October 7th through the 14th, you'll be given instructions on re-enrolling, and you'll have a link actually provided to you so that you can re-enroll in the program, and that will be during open enrollment. Yes, you're welcome. And then Andrea, she says she's gotten a few calls on employees that lost their card and want to know if they can automatically get a new card for the new year. Can you please explain what they need to do to get a new card?
Yes, a new card won't automatically be sent if you are already enrolled with a card that's not expired. You keep your same card from year to year, and your new election just gets loaded onto that same card. But if you have lost your card anytime during the year, you can go and request a free replacement card. You just need to do that through our website, or you can get the form. Your human resource office may have it, but there's a form to request a replacement card. And you'll let us know if the card was lost or stolen, then we need to give you a new card number as well. If you just need a new card because yours is worn out or no longer usable for some reason, then you can let us know that as well.
Okay. Another great question coming through from Lori. What cases are prescriptions needed for OTC items?
The only time that prescription would be needed for an over-the-counter item now, because all drugs and medications that are over-the-counter are eligible without a prescription, be things like vitamins and supplements. And the reason why a prescription would be needed for those, actually not a prescription as much as a doctor's note, a doctor's letter verifying that there's a medical need for the supplement or vitamin, because so many vitamins and supplements are just taken as preventative or general good health reasons. But if you have a specific medical condition that requires you to take a certain vitamin or supplement, then your doctor could just write a note stating what that condition is and what the prescribed item is. We'll keep that on file for the whole year, and then you can submit that as many times as you need to purchase it, and it will be reimbursed. But any type of over-the-counter medication, anything that has a drug in it, anything that is approved by the FDA would qualify without a prescription, and that includes supplies. And you can look, the FSA store is a wonderful resource, even if you choose not to order your items through the FSA store. It's linked on our website, but they have anything on their website is automatically covered under an FSA. So if you wanted to just check something, you could look for it on their website. They have thousands of items, all kinds of things, even the sunblock and even makeup with sunblock in it and SPF. So all kinds of things are included there, and that I would check that if you were wondering if something was covered. There are 2 vitamins and supplements that are covered. It's because they are known to treat certain conditions, and one is prenatal vitamins. Those are covered without a prescription, so you'll find them on the FSA store. And the other is glucosamine, which is it's joint. It's proven helpful for joints, so it is covered without a prescription. Yeah.
And Andy, this is Ann Johnson. I just want to also clarify one additional thing.
Yes.
So over-the-counter prescription drugs is a new item that's covered under the FSA. It was covered years ago. Then under the Affordable Care Act, it was removed. The CARES Act, which was passed in March of this year in response to the coronavirus, this was one of the items that was included. So Andy, I'm not positive of the effective date. So Lori, if you were filling a prescription if you were getting an over-the-counter item last February, it would not have been covered. But then Andy will give us the date that those purchases were eligible for coverage.
Yes, the CARES Act was passed in March, but it made the change retroactive to January 1st of this year. So anything that was purchased, we went through a lot of denied claims for over-the-counter items that had been submitted without a prescription, and we even went ahead and paid all of those. So if you had something that you were holding on to the receipt for and you still have funds, you could send in anything that was purchased as of January 1st of this year. And they made it a permanent change, so the effective end date is there isn't going to be one. It is a permanent change as far as we know.
Great, thank you. We have another question. Kristen has another really good question. If we have an ongoing fee like a monthly orthodontic payment, will we need to submit documentation every month?
With orthodontia, a monthly payment that is recurring is one thing that you could use your debit card for. So as mentioned, those recurring payments that are exactly the same amount with the same provider each month are automatically adjudicated. We would just need to have the documentation sent in one time. So you wouldn't have to send that in each month. You would either need to file a claim each month or make your payment monthly with your debit card, which is effectively the same thing as filing a claim. It's just that the money doesn't come out of your personal account, it comes off of your pre-funded debit card.
It's easier to use your debit card, really, if you've set it up.
Yes, especially with the recurring payment, it would be easiest, because when we've already checked it one time and we know it's the same payment each month, it will automatically be approved.
Great.
Yeah.
Do we have any other questions coming through? All right.
That's all I see, but
Okay. Okay, Anne just said, are there any other details employees should know? I think you covered a lot of really great information, and but if there's anything offhand.
I think it's important to know that we have a wonderful customer service team. They are available extended business hours, 7 a.m. to 7 p.m. Central Time. And you always get a live person when you call ASI. There's not a recording, there's no phone tree to jump through. You'll always get an answer by a live person. So if they can't help you, they will hopefully transfer you to somebody who can. We also have Saturday hours from 9 to 1. And you can email us with questions also.
And Andy, my question was specific to ortho.
Oh, I'm sorry.
Definitely just get quite a few questions around, especially since it goes year to year. So
Yes.
I was just asking, are there any other questions that you see come up that you think it's important for our employees to know? And I apologize, I can't type.
No, that's okay. Good question. Orthodontics is a big hot subject, and it is important to know how you can be reimbursed for orthodontic claims because it's such an expensive purchase. Some employers allow reimbursement of the full amount up front, but the IRS is kind of gray in this area, and they really prefer it if it's done as the treatment is ongoing. And so APS has decided that's the way that they're going to do it, and allow treatment as it's ongoing. So a monthly orthodontic payment is allowed. And also, if you get the braces put on and begin treatment during the plan year, you can also be reimbursed for the down payment if there is any down payment required. So a lot of people will start treatment, pay a down payment of 20 to 50% of the total, which is reimbursable at the time of treatment. We would just need to have a copy of the contract that shows that that amount was the down payment, not the full cost of treatment. And then the monthly payment, as mentioned, would be the same each month, so that would be automatically reimbursable, either with your debit card or through filing a monthly claim. Looks like there's another question. Did I answer that fully though, or do you think there's more information about orthodontics? There is some information on our website, which you can certainly look at about orthodontics in particular if you go to our eligible expense listing. If at any time the treatment finishes earlier than expected, the full cost of orthodontics could be reimbursed at that time. Any remaining balance could be reimbursed because treatment is considered complete once the braces come off. So that's another thing you might want to know about. So you can check that information on our website if you have additional questions specific to orthodontics.
That's great information. I'm going to use that. Okay, for two girls in braces.
Oh, yes. We're heading there ourselves.
Thank you. We have a great question again from Lori. Just to clarify, the extended 3 months is for both incurring and submitting expenses, not just submitted expenses from the prior year.
Correct. Yes, that's grace period gives you additional time to incur expenses. So your plan year is effectively 14 and a half months instead of 12 months. So you get from January 1st of 2021 all the way through March 15th of 2022 to incur expenses. And then you still have an additional 2 weeks beyond that to file your claims. March 31st would be the filing deadline to get your claims into us by.
Since APS, and this is similar as goes through March, does this mean purchases made in January and February 2021 can be paid out of the 2020 account?
Also a good question. Yes, we always pay from the oldest available funds first. So if you still had funds remaining and it's the new plan year, but you had money left in your old account, then that money would pay out first because you want to use up that old balance first. If for some reason you didn't want to do it that way, you can let us know and it is possible for us to move it, but we will always pay out of the oldest balance first.
Great, great. Thank you for that information. That's a good point.
Yes.
Are costs for fitness classes and gym memberships reimbursable? Awesome question, Lori. Thank you.
Yes, another good question. And this is very similar to the vitamins and supplements issue, where it could be if you are taking your fitness classes or need a gym membership to treat a specific medical condition and your doctor has prescribed that, then all you need is that doctor's note verifying that, and then you can submit those expenses. If you are just taking fitness classes or need a gym membership for general good health, then it isn't something that's covered.
Physical therapy, chiropractic, and acupuncture care. Does that
Physical, yeah, those things are always covered. Acupuncture is considered medical, and you wouldn't just get it for no reason. So acupuncture is covered without needing a doctor's letter. Physical therapy is as well. Chiropractor services are covered in full without question or doctor's letter. Again, the eligible expense listing on your website gives information about a lot of things that you might not have thought of that could be eligible potentially or that are eligible without question. So the gym membership and the health club dues, those would be covered with a doctor's letter. And so that eligible expense listing would indicate that items that are always covered, items that are covered with a doctor's letter, and items that are not covered.
Awesome. I think we can move forward if we have any. I want to thank Andy and ASI Flex for joining us this morning to help you all through this process and understand this awesome benefit that we are able to bring to you. I'm just going to wrap up with a couple of items here just to kind of remind everyone that we have some more webinars later today with Nusenda, the education plan, and the standard. And also let you know that we have open switch enrollment webinars Monday and Tuesday at 7:30, 12, and 3:15. You only need to come to one. It's just going to be us giving you the 411 and a quick overview tutorial on how to do that Winocular system. You are all familiar with Winocular, and we're just going to walk you through that process so you have no problems with your open switch enrollment this year. And we just, again, are going to remind you about the open enrollment information being on the intranet under open enrollment, and also that we have a wellness walkthrough event on Thursday and Friday next week, the 8th and 9th from 8 to 3:30. We're going to have vaccinations, mammograms, and a blood donor drive, and all of that information is available to you on our open enrollment landing page. This is a hand sanitizing, mask wearing, socially distanced event, and it's also a walkthrough event for you to get some preventive health services. We are going to have laptop stations should you need any assistance with that Winocular open enrollment and system. We will have some laptop stations to help you all, but we do ask that you first attend a webinar or watch a tutorial. We do think it's going to be a pretty seamless process for you. We ask that you please do not come down to City Center. We're holding these events over at Bonifacio so we can make it safe and effective for everyone. So please don't just show up at City Center. We're at Bonifacio on those 2 days. I just want to thank everyone for joining us. I know some people had to pop off the call, but just for attending, I think you're a winner. But you could also be a winner in our raffle because we're raffling off prizes for all of our webinars. So if you get an email from me, it means you're a winner, and I will be contacting you. Again, I want to thank everyone, and I want to thank Andy and Anne and Andrea and Sheila for being in that chat box. And that concludes our presentation today. And thanks again. Everybody go forth and have a wonderful, wonderful day.
Thank you. You too.
Thank you, Andy.